Hi, I'm Dr. Estevana Isaac. I am the Penn Memory Center Cognitive and Behavioral Neurology Fellow. And today we are going to talk about elder abuse. And in talking about elder abuse, we are first going to discuss what is a vulnerable elder. A vulnerable elder is an older adult with a cognitive impairment that renders them unable to arrange for adequate self-care and protection. So in 2005, 41% of older adults with Medicare benefits actually had difficulty performing activities of daily living and needed some type of paid or unpaid support from caregivers. So as you can imagine, we're estimating about 41% of the Medicare community would be considered a vulnerable elder or would qualify for that definition. So what is elder abuse? Elder abuse in a systematic review back in 2015 was included physical abuse, neglect, self-neglect, and financial exploitation. And what they found in that study is that 10% of cognitively intact older adults reported elder abuse. However, when you're looking at patients who are diagnosed with dementia, meaning some type of cognitive impairment that impacts their activities of daily living, that number increased significantly to 47%. So like I said, once you're considered a vulnerable elder, that risk for elder abuse increases. And while there is an increased reliance on empathy to drive decisions, many older adults are reluctant to actually report elder abuse or neglect out of fear of being removed from their homes or implicating family members. There are studies that find that 90% of these cases of elder abuse actually involve family members, either a spouse or an adult child. So like I said before, some of the risk factors include dementia, which is a cognitive impairment that impacts activities of daily living, mainly because they often don't recognize or remember these offenses. As you get older, there is a decline in executive function, which is normal executive function, meaning the ability to develop a plan, adapt to circumstances, and implement that plan. And that does ultimately affect your decision-making capabilities. Like I said before, 10% of cognitively intact older adults were also, victims of elder abuse. Other things to keep and other things to consider is social isolation and depression. So social isolation, feelings of loneliness, when someone calls you and, you really want to encourage that conversation, mainly because you're looking for company or looking for someone to talk to. Otherwise, that person on the other line, on the other side of the phone, is looking to scam you. So it's definitely a recipe for exploitation, financial exploitation in that context. Depression, late-night depression is not uncommon in older adults, and it can cause like a loss of capacity for self-care and protection. And that also increases your risk of elder abuse. And just keep in mind that lower education and income levels have been associated with neglect and emotional abuse as well. So some of the warning signs, primarily for financial exploitation, is just the changes in the ability for an older adult to pay for services that they previously could afford. So that includes medications, utility, housing, or food. And this can sometimes be difficult to detect in patients who are diagnosed with dementia, mainly because you do need someone there to help with managing finances. But if there is an uneven distribution of wealth within the home, then that can be an indication that someone is taking advantage of their ability to taking advantage or financially exploiting that older adult. Other things to keep in mind is just a high caregiver burden can, lead to a lot of unmanageable stress, depression, anxiety, and there can be a lot of miscommunication that comes with that. Also, just having so much responsibility, it increases the likelihood that there is going to be some neglect in the picture. So always ask directly about abuse in all contexts. Some signs of neglect that we can detect within the clinic is just malnutrition, dehydration, and pressure ulcers. So what can we do? So as healthcare workers, social workers, community agencies, they're all there to assure the safety of at-risk older adults. So definitely tell anyone who could be in those roles, who are in those roles, to help with that situation. There can be a home visit by a nurse or another clinician who can assist with determining is there elder abuse going on in that home or within that facility. And reporting suspected elder abuse or neglect to government agencies allows them to do a more thorough investigation. So even if you're not really sure, make sure that you report it just so there is a thorough investigation that does happen. The main government agencies that cover these cases are the Adult Protective Services for community dwelling older adults, and LTCOP, which is for adults living in facilities. So if you go to the National Center on Elder Abuse website, which is listed here, there is a list of phone numbers to report suspected abuse case by state. So it's a different number for each state. So definitely look at that website to ensure that you have the right number for your state. LTCOP also has a website itself where you can report where you can find that information as well for older adults living in facilities. And listed here are the references for this presentation. And I will be available at the end of this presentation to answer any additional questions that you may have. Thank you for your time.